There are several important structures you may understand. Let's look into these structures in more detail. The first one is choana. In this figure, we can find choana here. Choana is the posterior nasal aperture. The two posterior nasal apertures are located at the end of the nasal facet. They are separated by free posterior border of the vomer. There may be a vomer here, like this. And bounded below by the posterior border of the horizontal plate of the palatine bones. This is the horizontal plate of palatine bones. Horizontal plate of palatine bone. And above by sphenoid and laterally by medial pterygoid plate. This is a medial pterygoid plate, and above is the sphenoid bone. And medial pterygoid. Not to mention, medial pterygoid is also the portion of the sphenoid bone. The next one is the pterygoid process of sphenoid bone. The pterygoid process of sphenoid bone on either side descend perpendicularly from the region where the body and the greater wing of sphenoid bone unite. In this figure, probably around here, in pink colored region. And each process consists of medial pterygoid plate and lateral pterygoid plate. Naturally, this is a lateral pterygoid plate. And the lateral of which serve as the origin of the medial and lateral pterygoid muscles. The medial pterygoid, along with the masseter, allows the jaw to move in a vertical direction as it contracts and relaxes. The lateral pterygoid allows the jaw to move in the horizontal direction during mastication. Fracture of either plates are used in clinical medicines to distinguish the Lefort fractures classification for high-impact injuries to the sphenoid and maxillary bones. The medial pterygoid plate or medial pterygoid lamina of the sphenoid bone is a horseshoe-shaped process that arises from its underside. It is narrower and longer than the lateral pterygoid plates and curves lateralward at its lower extremity into a hook-like process, the pterygoid hamulus. In this figure, we can mark the pterygoid process, pterygoid hamulus here. The pterygoid hamulus has the tendon of the tensabelli palatini glides around the pterygoid hamulus. The lateral pterygoid plate of the sphenoid bone or lateral lamina of the pterygoid process is broad, thin, and everted, and forms the lateral part of the horseshoe-like processes that extends from the inferior aspect of the sphenoid bone and serve as the origin of the lateral pterygoid muscle. In this figure, we colored lateral pterygoid process in here in the yellow-brown. The lateral pterygoid plate of sphenoid bone don't have a pterygoid hamulus. The pterygoid hamulus is a hook-like process at lower extremity of the medial pterygoid plate of sphenoid bone. As I said, around it glides the tendon of the tensabelli palatini. As well, it is superior origin is the superior origin of the pterygomandibular rive. Pterygoid fossa. The pterygoid fossa is the lateral and medial pterygoid plates of pterygoid process of sphenoid bone diverge behind and encloses between them a V-shaped facade are made in here. as a red color. This is the pterygoid fossa. This fossa faces posteriorly and contains the medial pterygoid muscle and a tensor palatine muscle. Scaphoid fossa. In the pterygoid process of the sphenoid bone, above the pterygoid fossa is a small oval shallow depression, the scaphoid fossa. Here, the scaphoid fossa gives origin to the tensor palatine muscle, and it is not the same as and has to be distinguished from the scaphoid fossa of the external ear or pinna. Finally, the pterygoid notch. The pterygoid notch is a notch on the inferior portion of the pterygoid process of sphenoid bone between the medial and lateral pterygoid plates into which the pyramidal process of the palatine bone fitted. This pink colored triangle is the pyramidal process of palatine bone, and this V-shaped notch is a pterygoid notch. The pyramidal process of palatine bone projects backward and lateralward from the junction of the horizontal and vertical parts and is received into the angular interval between the lower extremity of pterygoid plates. On its posterior surface is a smooth grooved triangular area limited on either side by a rough articular furrow. The furrow articulates with the pterygoid plates, while the grooved intermediate area completes the lower part of the pterygoid fossa and gives origin to a few fibers of the pterygoides internus, that is the medial pterygoid muscle. The next structure we will talk about is a groove or auditory tube. The lateral half of the greater wing of the sphenoid bone articulates by means of the synchondrosis with the petrous part of the temporal bone. Around here, between these two bones on the undersurface of skull is a furrow, named as sulcus or groove or auditory tube, for enlargement of the cartilaginous part of the auditory tube. There is a petrosphenoidal fissure on the floor of this groove. The cartilage of auditory tube lies in a groove between the petrous part of the temporal bone and the greater wing of the sphenoid bone. This groove ends opposite the middle of the medial pterygoid plate. The cartilaginous and bony portion of the auditory tube are not seen in the same plane, the former inclining downward a little more than the latter. The diameter of the tube is not uniform throughout, being greatest at the pharyngeal opening, least at the junction of the bony and cartilaginous portions, and again increased toward the tympanic cavity. The narrowest part of the tube is termed as isthmus. The greater wing or ala sphenoids are two strong processes of bone which arise from the side of the body, are curved upward and lateralward and backward. We are talking about the greater wing of the sphenoid bone. The posterior part of each projects as a triangular process which fit into the angle between squama and the petrous portion of the temporal bone, presents at its apex downwardly directed process spina angularis. The other line of spinal angularis is the sphenoidal spine. Here is the spina angularis. It serves as the origin of the sphenomandibular ligament. Fossa. In this figure, this is the mandibular fossa, and the mandibular fossa is the depression in the temporal bone that articulates with the head of the mandible or the mandibular condyle. It is located posterolateral to the spina angularis. As I said earlier, this is a spina angularis. In the temporal bone, the mandibular fossa is bounded anteriorly by the articular tubercle. There is an articular tubercle. Sometimes it can be considered as the whole articular eminence, and posteriorly by the tympanic portion of the temporal bone. This is the tympanic portion of the temporal bone, tympanic part, which separate it from the external acoustic meatus. The facet is divided into two parts by a narrow slit, the petrotympanic fissure. This is the petrotympanic fissure. Sometimes it is called as a Glasserian fissure. The anterior boundary is articular tubercle and eminence. The medial to the articular tubercle, there is a low elevation called as the articular eminence. The posterior boundary is the tympanic part of temporal bone. As I said, medially it is bounded by the spina angularis and laterally by a low elevation here. Okay, and there are 5 notable structures on the line between mastoid process and ala of vomer from lateral to medial side. And this is the mastoid process, and this is the vomer, and in this line there are 8 important structures we should memorize for exam, and let's write down their names for practicing. Number 1 is mastoid process. Number 2 is a stylomastoid foramen. And number 3 is a styloid process. And number 4 is the jugular foramen. Number 5 and 6 is the carotid canal. And number 5 is external orifice. And number 6 is the internal orifice of carotid canal. And number 7 is the foramen lacerum. And number 8 is a pterygoid canal. As I said, this side is the lateral, and to this side is a medial. Let's look into these structures one by one. The first one is the mastoid process. This is a mastoid process, and the mastoid process is an inferior pyramidal shaped projection of the temporal bone. It lies posterior inferior to the external acoustic meatus. The mastoid process serves for the attachment of the sternocleidomastoid muscle and the posterior belly of the digastric muscle and splenius capitis and longissimus capitis. On the medial side of the process is a deep groove and mastoid notch for attachment of the posterior belly of digastric muscle. Here in red colored notch, and medial to this notch there is a shallow furrow, the occipital groove, which lodges the occipital artery. In this figure, this is the groove for occipital artery. But these structures will be described in the posterior part of the inferior view skull in the next video clip. The stylomastoid foramen. This foramen is the stylomastoid foramen. Between the styloid process and mastoid processes of temporal bone, there is a stylomastoid foramen. It is the termination of the facial canal and transmits the facial lobe and the stylomastoid artery. The styloid process. This is the styloid process. Styloid possesses slender pointed pieces of bone just below the ear. It projects down and forward from the inferior surface of temporal bone and serves as an anchor point for two ligaments and three muscles. That is the stylohyoid and stylomandibular ligaments, and as a muscle, the styloglossus and stylohyoid and stylopharyngeus muscles are attached to this process. And number 4, the jugular foramen. In this figure, we can find the jugular foramen in here, red colors area. The jugular foramen is a larger foramen or opening in the base of skulls located behind the carotid canal. It is formed in front by the petrous portion of the temporal bone and behind by the occipital bone. It is generally larger on the right than on the left side. The lower border of the jugular foramen is smooth and formed by the lateral part of the occipital bone. This is the occipital bone, as you know. The upper border is sharp and irregular. It is formed by the petrous part of the temporal bone. As you know, this is a petrous part of the temporal bone. It contains a notch in the called as an intrajugular process. And this small blue colored triangle is an intrajugular process which divides the foramen into larger posterolateral compartments. The posterolateral compartment around here, sometimes these compartments can be called the sigmoid part or the pars vascularis, which receives the drainage of the sigmoid sinus, and a small anteromedial compartment here in yellow color, which is called petrosal part or the pars nervosa, which receives the drainage of the inferior petrosal sinus. The accessory nerve and vagus nerve and glossopharyngeal nerves or cranial nerves courses in the medial side of the intrajugular process. That means that the in medially 3 cranial nerves transmits. They lie between the petrosal part and the sigmoid part. The next one is the external or internal orifice of carotid canal. Around here, there is a external orifice of carotid canal. The carotid canal is a passageway in the temporal bone through which the internal carotid artery enters the middle cranial fossa from the neck. The canal starts on the inferior surface of the temporal bone at the external opening of carotid canal with the carotid plexus traveling on the artery. In some literatures, this external orifice of carotid canal is sometimes called as a carotid foramen. This canal ascends at first superiorly and then, making a bend, runs anteromedially, and the canal's internal opening is near the foramen lacerum. This yellow-brown color is the internal orifice of the carotid canal. Above the foramen lacerum, the internal carotid artery passes on its way anteriorly to the cavernous sinus. The next one is the foramen lacerum. The foramen lacerum, lacerum means the lacerated piercing, is a triangular hole in the base of skull located between the sphenoid and apex of petrous temporal and the basilar part of the occipital. It can be denoted as like this triangle in here. It is a juncture of the petrocleval and sphenopetrosal and the petrosphenoidal sutures. The location of the foramen lacerum can be described as anteromedial to the carotid canal and posterolateral to the ala of vomer. And the pterygoid canal, the final one. The pterygoid canal, also Vidian canal, is a passage in the sphenoid bone of the skull leading from just anterior to the foramen lacerum and in the middle of cranial fossa to the pterygopalatine fossa. It carries the artery, vein, and nerve of the same name. Hello everyone. This video clip introduces lateral view of skull. The skull, viewed from the side or laterally, may be divided arbitrarily into cranial and facial portion by line extending between the lateral projection of frontonasal suture here and mastoid process. The tip of mastoid process like this. This is a very arbitrary and rough concept. Some textbooks like Gray's Anatomy are subdividing the skull into three zones: face, temporal region, and occipital region. That means anterior, medial, and posterior. In this case, the face has been considered in the section on the anterior view of the skull. Anyway, in this video clip, we will adopt the former concept. The cranial part. Here, we ought to understand 12 anatomic structures in the cranial part. First, I will show you the name of the 12 structures. First, the temporal line, temporal fossa, external acoustic meatus. Number 4, styloid process. Number 5, mastoid process. Number 6, suprameatal triangle. Number 7, mandibular fossa. Number 8, articular tubercle. Now, number 9, articular eminence. Number 10, postglenoid process. Number 11, zygomatic arch. Number 12, zygomatic process of temporal bone. In this figure, number one is like this. Number 1. Number 2, temporal fossa is here. Number 3, external acoustic meatus is here. Number 4, styloid process is here. Number 5, mastoid process is here. Number 6, suprameatal triangle probably located here. Number 7, mandibular fossa is here. Number 8, articular tubercle here. Articular eminence is also located here inside of the articular tubercle. Number 9, articular eminence. Number 10, postglenoid process located here. Number 11, zygomatic arch is here. Number 12, zygomatic process of temporal bone is the part of the zygomatic arch in some part around here. Okay, now I will describe these structures in detail from now on.